Welcome, everybody, to the Cone of Shame Veterinary Podcast. I am your host, Dr. Andy Rourke. Guys, I got a good one today. I have got an itchy, soft stomach young dog. This dog has bouts of soft stools and a little bit of vomiting, just a little bit. And he also gets ear infections and some slightly itchy skin. I'm sure you've never seen anything like this. Not super common at all. Guys, I want to unpack this. I want to get up to date. I want to get the tips, the tricks, and the pearls that I need to do a really, really good job with this case. And so I have brought in my friend, Dr. Jason Gagné. Dr. Gagné is a board-certified veterinary nutritionist, and he is Purina's Director of Veterinary Technical Communications. He is a super smart guy and a pleasure to talk to. Gang, this episode is, man, I'm so happy. I'm so pleased. This episode is made possible ad-free by Purina Pro Plan Veterinary Diets. Let's get into this episode.
This is your show. We're glad you're here. We want to help you in your veterinary career. Welcome to the Cone of Shame with Dr. Andy Rourke.
Welcome to the podcast, Dr. Jason Gagné. Thanks for being here.
Yeah, thanks so much for the opportunity. It's really nice to get together with you today.
Oh man, my pleasure to have you here. You are a board-certified veterinary nutritionist. You do a lot of different things. I have a case for you that I think is going to be right up your alley, and I was wondering if I can run it past you.
Yeah, let's hear it.
All right, cool. So I have Budrow. Budrow is a 3-year-old, we call him a Carolina yellow dog. Some people call him Heinz 57. He is no kind of pure breed I've ever seen. He is a mixture. He is a shelter dog, and he's a super nice guy, a sweetie. He's probably about 35, 40 pounds, sort of brown, black checkerboard kind of dog. Just a happy 3-year-old guy. The problem I'm having with Budrow is that he's 3 years old and he has had intermittent vomiting and soft stools for 1.5 years. Just off and on, and different like oftentimes it'll be just wellness checkup, and they'll just kind of bring it up, and sometimes he kind of comes in and they say, ooh, this is getting kind of bad, and
yeah.
It's never awful like emergency, but it's always, hey doc, I don't think this is normal. They call it the soft stomach. Budrow's soft stomach is bothering him.
Soft stomach, sensitive stomach.
Yeah. At the same time, he's the reason I end up talking to him about his stomach is he's in for ear infections.
Oh.
And so every like 3 to 6 months he comes in for sort of shaking his head, or just he's got some allergy flare-ups. And again, he's not awful dog. He's not a bald dog. He's not a beet red dog. These are just mild nagging symptoms. And so I wanted to ask you about this because I'm not fixing Budrow and it's bothering me.
And it's just been occurring off and on for 1.5 years?
Yeah, but he's only 3. And so, yeah. I mean, it's fairly early on. So anyway, so I've been talking to the owners about this and going back and forth. They want me just to fix. They just want me to fix the problem, And I talked to them a little bit about diet and things like that. And I've gotten them to, they'll try some different things. They're doing some over the counter, limited ingredient diets, stuff like that. Just
sure.
And mostly they're like, no, I think he needs an allergy medicine or things like that. And I'm having a hard time just sort of unpacking this. There seems to be a lot going on. Just let me. Yeah. I know I just sort of gave you a hot mess. Help me break this case up.
Sounds like a great case. I may have heard the story once or twice.
Yeah. There's a lot going on with Budrow, and I just help me to break this apart into bite-sized pieces and figure like how do I work this case up first of all, and then how do I get these people on board with where we need to go?
Yeah, sounds so. Have you done any sort of treatment in the past with him before, like antibiotics or antihistamines?
Yeah. Oh, I mean, for treating ear infections, he'll scratch around his neck and everything, get a skin infection. He'll end up on some cefpoderm, things like that.
Okay.
And then just basic bland, cycling on to bland diet, cycling on to high fiber diet. I thought maybe it was a sort of increasing fiber earlier on might be helpful. And so he cycles on to short-term therapeutic diets and then back off again to get back onto whatever his owners are sort of excited about.
Well, I think you raised a really good point there in the beginning when you were telling me about how long this has been going on, and in taking your history of this dog. So 3-year-old dog, year and a half, it's a pretty significant amount of time. So
yeah,
and
it's always it's always one of those things where like he comes in and they're like, no, this time it's his skin, it's not his ears, it's different. And I go, I feel like these things are all tied together. At some point, we keep having general skin and general stomach problems.
Yeah, and sometimes obviously it could occur separately or it's occurring together, the GI and the skin signs, but as well as the ears. So let's call it derm. Happening there. And you said they tried some other diets, like limited ingredients, over the counter foods?
Just over the counter stuff. Yeah. Not therapeutic diets necessarily, but yeah, okay. they get excited like many pet owners do about there was some grain-free stuff they were really excited about. There was a bison diet that they found that they thought was very affordable that they liked, and just stuff that they find at Tractor Supply, Costco, things like that. Not any specific place, but they sort of light on things and they get these recommendations and they get excited about them. And I haven't been able to guide them away from that.
Right. So no, I'd say, first of all, I think one of the most important points to bring up is that in, your history taking of this dog, just sitting back, listening to the owner and, the observation that this has been going on for a year and a half. Okay. Mm-hmm. And the fact that some medications have been tried, the fact that some, let's call them limited ingredient over the counter foods have been tried, to no avail. So I think there's a little bit to unpack there. And because of something like a non-seasonal pruritus, the off and on GI signs with the loose stool, maybe a little vomiting, I think, we have to start to rearrange our differential list there. I think we need to start thinking about adverse food reactions, actually.
Okay.
And I think, it's really interesting for me as a nutritionist to look at that problem. And it's where food could be your friend, but it could also be your enemy at the same time. And then it could be the solution to the problem. So let me ask you this. Is the dog in a good body condition score, good muscle condition, good appetite?
Yeah, exactly. Yeah, he seems to be, it's kind of one of the confounding parts of the case is that he seems to be pretty much super happy guy. I think if he was less happy, his owners would be more motivated to wade into this. Yeah. And so he seems to, he seems to hold his weight well. He seems to be energetic, playful, goofy guy.
So I think, so really a good place to start would be maybe an elimination diet trial. And having that conversation with the owner that, again, food may be something where it doesn't seem natural, but sometimes, the immune system starts to recognize certain ingredients, certain foods as an enemy. So how do we work with that dog and understand how nutrition can actually be a therapy rather than hopping around from medication to medication, and at the same time doing good by our profession of antibiotic stewardship too.
Yeah, no, I agree with that. That makes sense. So let me get into the nuts and bolts of what I kind of need your insight on. Okay, so I've got this dog, I've got Budrow, and he's having this upset stomach. He's having some soft stool, and he's having just intermittent vomiting and everything. And that's what they're in for, most recently. And I'm 100% on board with the diet trial. And I think that I can make this case of, hey, it's been a year and a half now. It's time to do this.
Yeah.
How do I actually implement and carry out the food trial while treating the condition that he has? Do I want to get him stabilized and then start this food trial? Am I changing his diet while he's having this soft stool and GI general upset? Help me figure out what does this look like to implement the food trial while I have a dog that is symptomatic and kind of itchy?
So in my experience, communication is of utmost importance with these owners. It truly is, because you have to get them to buy into it in order to do good by the dog like we want to do. Right? So what we need to do here is inform these owners and discuss with them what an adverse food reaction is. The immune system may be recognizing food as a foe. And at that point, we need to take a complete dietary history. We need to see what this dog's been eating. You mentioned that the dog has been eating some of the limited ingredient over-the-counter foods, right?
Yeah.
And explain to them that while they're good foods, complete and balanced, etc., they may not be taking into account limited ingredients. Okay, that's what they are. There may be a little bit of cross-contamination of proteins within the manufacturing environment. So we need to kind of move away from those over-the-counter foods. And the reason I bring up the protein is, as we know, it's an intact protein that is usually the cause of the adverse food reaction.
Okay, let's unpack that a little bit. So spell that out for me a little bit more. So when they say, "Hey, I've got this diet. It says it's limited ingredient," you say there may be cross contamination, things like that. Help me. Lay out what you mean when you say that. Help me understand how to sort of explain that to clients.
Yeah. So there are many companies out there that sell foods over the counter, right?
Mm-hmm, sure.
They may want to make a bison food or a venison food, and that's wonderful, as they should. That may be something that a dog has not consumed before and is on these signs. So we may think, hey, you know what? Go to the pet store, get that bison food, try that out. However, in that manufacturing environment of that manufacturer, it's possible that they have run their chicken and rice food, let's say, first, and then they run their bison and rice food or bison and potato food, whatever that may be. And there could be a little cross-contamination of that chicken in the bison food.
Mm-hmm.
And then if the dog has an adverse reaction to the chicken, they're still consuming some amount of chicken within their bison food. That's right. What I'm saying is, so that's why I err to the side of a therapeutic food, because you have those, what should we call them? Best practices, the standard operating procedures in a manufacturing environment, cleaning those lines, cleaning those conveyors so that you don't have that confounding factor potentially.
Okay.
Yeah. Does that make sense?
Yeah, it definitely makes sense. Talk to me, just give me the basics real fast of a food trial. Like, so what notes do I want to make sure that I hit when I do this? Because I want to do it. I know it's an investment. I know it takes time. I know we're gonna have to get serious about it. I'm gonna have to get utmost compliance from the client. Yeah. I want to do it right the first time. So what notes do I need to make sure I hit to run a good food trial?
Well, I think you need to be upfront that a therapeutic diet is a little bit more costly. Yeah. I do think that you, at the same time, you need to mention that the alternative here is some medications, which, depending on the severity of the GI signs or the derm signs, you may have to give some medications at first. But that you could err away from medications, you can err away from those side effects subsequently, and that food could actually be the solve here. Okay, the important thing here is that in that dietary history, you're saying, hey, what supplements are you taking? What treats are you feeding? Any table scraps? And, that really starts to come out in that conversation. And, you'd be surprised how many obesity cases I've solved with just asking those questions. The wife looks at the husband or the husband looks at the wife and says, oh, you're feeding the dog in the morning too? So then we wonder why they're overweight. But getting back to this case here, we need to really tell them, okay, I understand you're feeding this, you're supplementing that. We need to get away from anything that's flavored. We need to be pulling away those table scraps. We need to be pulling away those extra treats, so on and so forth, so that the only thing the dog is consuming for this elimination diet trial is the food, that therapeutic food that you're recommending. Okay. And if it's derm signs, it's typically 8 to 12 weeks in time. If it's GI signs only, usually you see a fix within 2 to 4 weeks. Okay. And if it's both, some of them, because so many dogs have GI and derm signs together, it's going to be the 8 to 12 weeks because the derm's going to trump the GI at that point.
Right. Gotcha. That totally makes sense. What are the keys in selecting my therapeutic diet?
Well, again, taking that dietary history, asking the foods that the dog has been on previously, it really helps there. Choosing if you want to go to a novel protein diet, that is a therapeutic diet.
Yeah.
I do find that that has been a little less efficacious over time, and that really is what gave rise to hydrolyzed diets back in the late 90s, early 2000s. So hydrolyzed diets have been great. They still continue to be great. But if you're not familiar with that concept, it's basically you take a parent protein and you break it into smaller pieces so that the immune system doesn't recognize those small pieces, and it's highly digestible as well. But oddly enough, some dogs do fail a hydrolyzed diet.
Yeah. Okay. I've seen that. And so
Yeah.
I wanted to ask you a little bit about that. So I have seen some sort of breakthroughs, some failures on hydrolyzed diets that they actually tend to do better on a novel protein diet, something like that. I've found those cases.
It does happen occasionally. I mean, you scratch your head at it, but really, in theory, if this does happen, it's possible that you break the parent protein into a smaller piece, and then that smaller piece refolds and it can act as an epitope, and the immune system flares anyway. Is the gist.
Yeah.
So
I always question adherence at home. You know what I mean? And even they're like, "No, doctor, I don't give them anything else." I go, I always struggle. I may have been unfair to those people because I haven't said anything, but
and that brings me back to my earlier comment about really clear communication of saying, I've taken this dietary history. I know what your dog has consumed. Now, this is all we're going to consume for 8 to 12 weeks on this therapeutic diet only. Because I, too, have made this mistake in the past where I've had people say, fail an elimination diet trial. And as I scratch my head and wonder why at times, I come back and say, all right, what are we feeding it? Tell me what's going on here. And I have had the owner who goes through the Wendy's drive-through and gets Frosty.
Yeah.
Okay, not really conducive to the trial.
Right. Right.
And
right.
So, I blame myself there, and I've really learned to hone my communication skills with these owners. And really, something else that's also truly important is that as we tell these people, these owners, to transition their dog over the course of a week onto that diet, we follow up with them at the end of the week. Someone should call them and ask them how it's going. How did that transition go? And then continue to encourage them to move along for the remainder of the trial.
Well, what am I looking for at week 1 when I say how did it go? I mean, so what is that?
A successful
what type of
transition, Andy.
And what is that? What is a successful transition?
So so they're feeding some diet as they come into you. You want to tell them to wean down on that diet over the course of a week, and then what would be the term there? Wane. Wax,
waxing.
Waxing. Right? Yeah, we're gonna wean down on the old food. We're gonna wax on to the new food over that course of a week, and you're slowly decreasing and the old and slowly increasing the new.
So success is just doing the thing.
Yeah, success is that.
Okay, it's just giving it to them. Okay,
yeah.
Okay, I got you. Now, I want to know if there was a clinical sign that you're looking for. Like, oh yeah, I go, and at week 1, if we're talking about 6 days, or I think you said. How many weeks was it for GI signs to resolve?
Usually
6 to 8 weeks? Or 2 to 4 weeks. Okay.
4.
So even then, okay. We're not there yet. So that's why I was pushing back on that.
No, success at the end of week 1 is that you have transitioned. If you see improvement at the end of week 1, that's great, but don't necessarily expect it.
Right. Okay. That makes sense. And set that expectation so they're not like, I've been doing this for a week and I don't see any difference.
Absolutely.
Given what we have in modern therapeutic diets, is there a time that you're going to not reach for a hydrolyzed diet to do this diet trial?
Yeah, I would say that what I really like to do at this point is, considering some of the novel protein diets out there are not as relevant anymore, unfortunately. And that's not because of them. That's just because many of those over-the-counter foods have started using those proteins as well.
Sure, it's gotten kind of bougie, and people
it really has.
Bison sells, and people go, oh, I want that, and so you see it everywhere.
It's novel to owners, but not really novel to your dog per se. So I've moved away from those. I still do go for hydrolyzed diets as well, but now there's an elemental diet out there as well, which is basically an amino acid based diet.
Okay, talk to me a little bit about that. How that differs from your hydrolyzed diets?
Yeah, so instead of a hydrolyzed protein diet where you're talking about a parent protein being broken down into smaller pieces, and then that really odd potential to refold and still stimulate the immune system, we're dealing with, in an elemental diet, you're dealing with amino acids only. So you're working from that foundation up rather than top down. The immune system isn't going to recognize amino acids. And, you look to amino acid-based diets in the past, really great success with pediatrics Crohn's patients for decades on these. And They're highly digestible. And obviously, they really hit the mark for novel as well. So,
Yeah.
very successful there, and have been shown to be excellent at malnutrition and GI disease.
Okay.
Yeah.
No,
Yeah. And I will back up for 1 second. I mean, we talked about a dog here that's in good body condition, good muscle condition, great appetite. Those dogs, if you know, at least in a textbook, I'm not saying this happens because it doesn't happen for me very often, but when you're done with that 8 to 12 week trial, if you got derm and or GI and derm,
mm-hmm.
theoretically, you're supposed to ask the owner to refeed the old.
Yeah. Yeah.
Okay.
Yeah. The retest. Yeah.
Yeah. I may be a specialist, but I'm not sure I have any better luck than you, Andy.
Yeah.
At getting people to do this. They may look at you like you got 3 heads. I ask the question. I communicate this with them if we want a definitive diagnosis, because it does help our profession to advance as vets, right? But that owner has every right to say, I'm not doing that.
Yeah.
Okay. And that's fair. That's fair at that point. So
I have those conversations where it's very much in my category of look, it's my job to tell you this.
Yeah. Occasionally you get that curious owner and they want to do it. And what's really cool though is that sometimes they flare and then you go back onto the food you were feeding and it works. That's one, the therapeutic food. And then they stay on that for life. That's great.
Mm-hmm.
Occasionally they re-challenge and the dog actually can go back to their old food. Now, I may not have said that. But it speaks to nutrition actually probably giving a rest to the epithelium and the mucosal healing, and nutrition really being the cure in that case.
Yeah, that's weird, fascinating. Yeah, but it validates some of the things that we've seen where you say a lot of times if I can get this calmed down, sometimes I can get at least a nice long break.
It's almost like a reset from
yeah, exactly right. That's a great way to put it.
Yeah, and for those owners that they may be a little bit of sticker shock at the therapeutic diet, and say this is a lot of money. Maybe they actually do want to do that re-challenge and go back to the old food and see what happens.
Yeah.
The only time I would not deviate from it and say no, you're on this food for life, is when you have the severe GI disease, the protein-losing enteropathies, the lymphangiectasias, etc., because you know that you have to stay therapeutic at that point.
Yeah, that does make sense. Yeah. Okay, that's super helpful. Yeah, and then also, because I've talked to clients and I've said, hey, look, this is the diet that we need to use, and they look at me and they're like, we can't afford this. This is a 3-year-old dog, but we hope Budrow is going to be around for another 10 years. And I go, this is 10 years of an expense, and it's nice to at least say, well, let's try this and let's get him straightened out and see if we can hit the reset button at least. And see what we've got. And sometimes they hit the reset button and they re-challenge and then he starts to itch again or he starts to have soft stools, but they're a believer in the diet, and they say, okay, well, we've seen this work. It's, once I think a lot of times people are looking at it and they're going, I don't know if this is going to work. I don't even know if this is really a problem that can be addressed with nutrition. They may not have totally bought into that. Budrow's ears comes from his diet idea. And so if I can just get them past that and get them to see some results, a lot of times I have a lot more credibility with them.
You know what? When you talk about the derm aspect of adverse food reactions and that true food allergy, that otitis externa, those ear infections, may be the only derm sign.
Yeah.
It's
I believe that.
Quite common. It's like that is the number one sign for derm in food allergy is the otitis externa. And, in addition to really stressing to owners and saying, this is the only food to feed, taking that dietary history first, really actively listening to how long this has been going on, the signs, the off and on. I think what's a really, 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 really important point is to stress that the alternative here is continued medications.
Right.
And you've already been doing that. Okay. And it doesn't seem to be working. The problems keep recurring. And, you think about it as we brought up about the antibiotics. Those antibiotics are really disturbing that GI microbiome. What does that mean in the long run? What happened there? The prednisone, the dampening of the immune system at the same time systemically. What are the side effects long term of that? So probably not good, and probably worth an 8 to 12 week trial.
Yeah, no, that makes sense. Yeah, I did a presentation in Orlando at the VMX conference, and I was talking about sort of the psychology of making recommendations. And there's this idea of reframing, and it's how we present concepts to pet owners. And so if I take them the therapeutic diet and I put it down and I talk to them about the price, if they compare that price to over-the-counter dog food that they get at the grocery store, it looks really, really expensive. If I compare it to the drugs and the medications and the examinations and the rechecks and the pain of dealing with infected ears, it looks like a much, much more reasonable cost. But it really is, how do you frame it? Are you comparing the therapeutic diet to the thing that they buy at the grocery store, or are you comparing it to the repeated visits to the veterinarian, the medications, the drug refills, things like that?
It's a whole slew of other things. And then lastly, again, the long-term side effects of the meds too.
Yeah, no, that's a really good point. Jason, do you have any final pearls, words of advice for me, or pitfalls that I should look out for when I go and have this conversation?
I'm just gonna, I think we've done quite a bit of talking here about it, and the importance of the communication, and just following up with these owners, particularly after that first week, to make sure that they're continue to be compliant, and then maybe some rechecks along the way there. During that elimination diet trial, touching base with them at the 2 to 4 weeks to make sure about the GI, and then definitely as we get out to the 8 to 12 week period too.
No, this is fantastic. Thank you so much for your time. Thanks for helping me with this. Where can people get more information if they want to learn more about therapeutic diets? You mentioned the new elemental diet. Where can people learn more about this?
Well, if you're interested in that elemental diet that I was talking about earlier on, I'd say a great website to look at there would be PurinaProPlantVets.com, or of course, like any company, reach out to your sales representative.
Good. Sounds great to me. I will put a link down in the show notes for people to get that. Thanks a lot for being here. I appreciate your time.
Yeah, it's been excellent. Appreciate the conversation. Good luck with Budrow.
Thanks, buddy. I'll need it. Bye. And that is our episode. That's what I got for you guys. I hope you enjoyed it. I hope you got something out of it, some tips, some tricks, some pearls, some new ways of thinking, or just a refresher on how to handle these uber common cases. Gang, take care of yourselves. Be well. Enjoy practice. Enjoy and do good things. Enjoying helping people and pets. And I will see you next time.